I've entered the room and washed my hands. My name is Colin Tarshan. Today is July 24th, 2022. I have Priya here. She's a 23-year-old female, born 1/1/99. She's found reliable in providing health history today. She's here for routine physical exam without any further complaints. Hi, so I just have a couple of questions about your history today, if that's all right with you. So the first, just medical history. Have you ever had any acute or chronic childhood illnesses?
No.
What about in adulthood?
No.
All right, and then any surgeries in the past?
No.
What about medications? Do you take any prescription medications, over-the-counter medications, or supplements?
No.
And then any allergies to medications?
No.
Any sensitivities to medications?
No.
Any environmental allergies?
No.
All right, and then GYN history. When was your first menstrual period, if you can remember?
May 2012.
Okay, and then when was your last menstrual period?
2 months ago.
And then have you ever, or are you sexually active?
No.
So have you ever been pregnant?
No.
No abortions, any spontaneous or induced abortions?
No.
All right. And then going on to family history, could you please provide family history from your grandparents to your parents and siblings?
I don't have any family history.
Okay. And then immunizations, are you up to date with all of your childhood immunizations?
Yes.
Are you up to date with the flu vaccine? Have you gotten the flu vaccine?
Yes.
And then what about the COVID vaccine? Are you up to date with that?
Yes.
And then just going back to the flu vaccine, what was the date? Do you remember the date that you got this?
October of last year.
Okay, and then the COVID vaccine, have you gotten both doses?
Yes.
Do you remember those two?
Pfizer.
Okay, and the dates?
It was last, February was the first one, last March was the second one.
Okay, and then did you get the booster?
Yes.
Okay,
That one was the beginning of this year.
great. And then also the tetanus, have you gotten the tetanus shot?
Yes. The last one was, I believe, either earlier this year or the end of last year.
Okay. And then for screenings, when was your last pap smear, or have you ever gotten one?
I never had one.
Never had one, okay. And then what about tuberculosis? Have you screened for
Yes.
tuberculosis? What were the results of that?
They were negative.
Okay, and then have you ever had a chest x-ray or EKG at all?
No.
Okay. And then how about hospitalizations? Have you ever been hospitalized?
No.
What about psychiatric history? Have you ever been hospitalized for psychiatric reasons? Any
No.
counseling in the past? No. Going into the social, now are you married, single, or do you have a partner?
I am single.
Single? Okay. And then sexual orientation, are you interested in males or females? Or?
Female.
Okay.
Male. Sorry.
And then children.
Don't know what happened there.
Do you have any children?
No.
Okay. And then what about work? What do you do for a living?
I'm unemployed and I go to school.
Okay. And then where are you living? Are you living in a house or apartment? Or
House.
Okay. And then do you feel safe at home?
Yes.
Okay. Do you have any pets that you're living with, or any
No.
other people that you're living with? Okay. And then just some safety precautions. Do you wear a seatbelt when in the car?
Yes.
Do you wear sunscreen when
Yes.
outdoors?
Mhm.
And then do you also wear a helmet when riding a bike as well?
I don't ride a bike, so.
Okay. And then for exercise, how often are you exercising?
About 3 times a week.
Okay. And then for how long would you say?
About 30 minutes to an hour.
Okay. And then for diet, do you include fruits and vegetables in your diet?
Yes.
Okay. And then for caffeine, do you drink any caffeine?
1 coffee every morning.
Okay. And then alcohol, do you drink alcohol at all?
No.
No. And then how about any recreational drug use?
No.
And then tobacco, any tobacco products?
Mhm.
And then do you have a religious preference?
Yes, I do.
Okay. And as a spiritual organization, we like to provide spiritual guidance to anyone who may need. Do you feel like you need any spiritual assistance today?
No.
Okay. Just getting into review of systems now, I just have some general questions about your health that I'll be asking you. So just generally, have you experienced any weight gain or weight loss recently?
No.
Have your clothes been fitting any tighter or looser than usual?
No.
Have you experienced any fever or fatigue?
No.
Do you notice any sleep pattern changes or any insomnia?
No.
All right, for your skin, do you notice any lesions, lumps, sores, rashes, itchiness or dryness to the skin at all?
No.
And then any color changes to the skin?
No.
Any color changes to the hair or
No.
nails? Changes in the color or size of moles at all?
No.
Alright, and then for the eyes, when was your last eye exam?
Sometime last year, middle of last year.
Okay. And then what were the results of that eye exam?
They were normal.
Okay. And then do you wear contacts or glasses?
No.
Do you experience double or blurred vision at all?
No.
Any excessive tearing?
No.
Any eye pain?
No.
No changes in vision at all?
No.
Do you see spots, specks?
No.
Flashing lights at all?
No.
Any previous history of glaucoma or cataracts? And then as I'm looking, I just forgot to ask about the head. So do you experience any headaches or head injuries?
No.
Do you experience any dizziness or lightheadedness at all? Alright, and then for the ears, do you notice any changes in your hearing?
No.
Do you wear hearing aids at all?
No.
Would you say that your hearing acuity is fine, you can hear everything?
Yes.
Okay. And then any discharge from the ears at all?
No.
Any frequent ear infections or earaches?
No.
Alright. And then any ringing in the ears?
No.
This is tinnitus. Any dizziness at all?
No.
That would be vertigo. And then for the nose, any bleeding from the nose at all?
No.
Any discharge from the nose?
No.
Nasal stuffiness, itching from the nose? How about frequent colds or sinus issues?
No.
And then hay fever, allergies?
No.
Okay. Moving on to the mouth now. When was your last dental exam?
Last year.
And okay. And then what were the results of that?
They were
Any
normal.
abnormalities? Okay. And then any like changes in your teeth, any tooth pain or any changes in the gums at all?
No.
Do you wear dentures?
No.
And then any bleeding from the gums?
No.
Any dry mouth or sore tongue?
No.
Any sore throats at all?
No.
Any hoarse voice?
No.
Alright, then moving on to the neck, any goiters at all? Any lumps in the neck?
No.
Any neck pain or any discomfort? Any stiffness in the neck? And then any swollen lymph nodes or glands?
No.
Then moving into the breasts, any lumps in the breasts or any pain
No.
or discomfort?
No.
Any nipple discharge at all?
No.
And then do you do any breast self-exams?
Yes.
How often would you say?
About once every other day.
Okay. And then for the respiratory system, any cough?
No.
Any coughing up blood at all?
No.
This is hemoptysis. Any shortness of breath?
No.
Dyspnea? Any wheezing?
No.
And then any bronchitis?
No.
History of bronchitis, asthma, tuberculosis, pleurisy,
No.
emphysema?
No.
Have you ever had a chest x-ray?
No.
Alright, and then for cardiovascular, any heart palpitations at all, or any heart murmurs?
No.
That you know of? Any chest pain or discomfort?
No.
High blood pressure?
No.
Rheumatic fever?
No.
Heart failure? Any swelling in the extremities at all?
No.
Any shortness of breath?
No.
Any waking up short of breath at night?
No.
This would be paroxysmal nocturnal dyspnea. And then any use need to use pillows at night to aid breathing.
No.
This would be orthopnea. When have you ever gotten a EKG before?
No.
Okay. Next, going on to peripheral vascular, have you experienced any intermittent claudication or any cramps in the legs at all?
No.
Any varicose veins or clots in the veins?
No.
Any swelling with redness or tenderness?
No.
Have you experienced any cold, changes in color or coldness in your hands in cold weather?
No.
That would be Raynaud's disease. And so just no pain or swelling in the extremities at all?
No.
Extremities in the calves or any swelling in the calves, okay. And then going into the abdominal system, any trouble swallowing?
No.
Regurgitation?
No.
Indigestion?
No.
Any heartburn?
No.
Excessive belching or passing of gas at all?
No.
Any abdominal pain?
No.
Food intolerance, there's no food you can't eat or anything? Any changes in your appetite at all?
No.
And then any nausea?
No.
Vomiting?
No.
Vomiting blood, hematemesis?
No.
I asked nausea. So just for the frequency of bowel movements, how often would you say a year?
About once every other day.
Okay. And then Could you describe the kind of the color and the size of the stools?
It's normal in color, normal in size.
Yeah, okay. And then any constipation at all?
No.
Any diarrhea?
No.
Black or tarry stools?
No.
Rectal bleeding or hemorrhoids?
No.
Any no constipation, diarrhea. I'm just making sure that I'm getting everything. Any pain with defecation?
Nope.
And then any liver or gallbladder issues?
Nope.
Any hepatitis?
Nope.
Any jaundice at all?
Nope.
Yellowing of the skin, okay. And then moving into the GU system, how often do you say that you are urinating?
Like 1 to 2 times per day.
Okay. Any polyuria, frequency of urination?
No.
Any hematuria, bloody urine at all?
No.
Any like frequent urination at night?
No.
That would be nocturia. Any urinary hesitancy?
No.
Urinary retention?
No.
Any reduced flow of urine?
No.
Dribbling?
No.
Any urinary infections?
No.
Urinary urgency at all?
No.
And then any kidney pain?
No.
Flank pain?
No.
Suprapubic pain?
No.
Any kidney stones at all?
No.
Alright, and then just for the female, I know you said you're not sexually active, so no pregnancies at all, no children, so no pain obviously with sexual activity, and then you said that your first menstrual period was
May
2012, and then your last one was recently. Okay, and then any bleeding in between menstrual periods?
No.
And then what about pad count? How often? Or how many pads do you use, would you say?
2, 3.
2 or 3. Okay, and then then how frequently are your menstrual cycles?
Every 28 days.
Okay, and then how long would you say they last for?
4 to 7 days.
Okay, and then moving on to the musculoskeletal system, any muscle or joint pain at all?
No.
Any arthritis?
No.
Any gout?
No.
No back pain or any stiffness?
No.
Okay. Then moving on to the neuro, have you experienced any changes in attention span?
Nope.
Any changes in behavior or speech?
Nope.
Any changes in memory?
Nope.
In cognition?
Nope.
In insight or orientation?
No.
Have you noticed any that you're lightheaded at all? Any dizziness?
No.
Any headaches? Any blackouts? Fainting?
No.
Any seizures?
No.
History of seizures?
Mm-mm.
Any weakness in the muscles?
Nope.
Any paralysis?
Nope.
Tremors or involuntary movements?
Nope.
Tingling? Do you feel like your lower extremities are tingling, or there's pins and needles
No.
type feeling? Okay. Then moving on to psych, any mood changes?
No.
Same with neuro as well, no mood changes at all?
No.
Okay, so for psych, no mood changes, you said no depression at all?
No.
Do you ever feel nervous
No.
or any tension?
No.
And you said you've never been hospitalized for any psychiatric reasons?
No.
No suicidal thoughts or ideations?
No.
And then how about have you ever seen a counselor at all?
No.
No psychotherapy?
No.
Okay. And then for the hematological system, do you notice any anemia?
No.
Do you notice any you're bruising easily or bleeding easily when
No.
if you get any cuts? Okay, and then have you ever had a blood transfusion before?
No.
Alright, and then for endocrine, do you have any thyroid issues at
No.
all? Any diabetes, history of diabetes?
No.
Any polyuria?
No.
No frequency urination? Any excessive thirst or hunger?
No.
And then any changes in the when you're wearing a hat or you're wearing gloves or shoes, any changes in that?
No.
No size changes in that at all? Alright, and I think that's it. Thank you very much.